What do you think? Does sleep apnea happen to blacks, or it is just a white man's problem? Apparently, it is most common in blacks and 3 times as prevalent in men than in women. It also can lead to hypertension, type 2 diabetes, and even stroke. Hi, it's Brilliant. Welcome to the Sleep Movement. Please subscribe to this channel to get more tips on sleep hygiene and health in general. When breathing, air moves into the nostrils, through the throat to the lungs. There's a canal behind the throat which significantly narrows as we sleep, causing snoring. In some people, this canal completely closes or blocks, leading to a pause in breathing. That is sleep apnea. One has to wake up again for the brain to prompt this canal to open up and start breathing again. This can happen for hundreds of times throughout the night. As you can see, sleep apnea definitely compromises sleep quality. Sleep apnea is generally common in adults, but nowadays it's also setting up root in children. There are 3 types of sleep apnea, namely 1, obstructive sleep apnea. This happens when the muscles around the throat collapse and constrict the airway. It is the most common type. It usually leads to snoring and happens to people with asthma or those who are obese. The second type is central sleep apnea. This happens when the brain forgets to send signals to muscles that control breathing. There is no clear reason as to why this happens, but most of the people who develop central sleep apnea would have been predisposed to stroke, heart disease, use of narcotics, or simply aging. The third type of sleep apnea would be mixed sleep apnea. This is when you have both the obstructive sleep apnea and the central sleep apnea. Risk factors to sleep apnea would be nasal congestion, smoking, constricted airway due to obesity, family history, use of sedatives, alcohol, and aging. Most common signs and symptoms of sleep apnea include excessive snoring, daytime fatigue, choking or a feeling of choking when you are asleep. In the morning you have headaches and dry mouth. To diagnose and treat sleep apnea, a sleep study is required at home or in a laboratory at the hospital or wherever a sleep lab is. This video is only for informative purposes. It should not be a substitute for a doctor's visit or consultation. There are several and effective ways of treating sleep apnea, including the use of devices like the CPAP. The CPAP machine applies a gentle air pressure into the blocked airway, forcing it open, enabling breathing. There is also an appliance called the mandibular advancement dental device, put in place by a dentist. It should fit like a mouthguard and it pushes the mandible forward to create space behind the throat. If the methods mentioned above fail, sleep apnea will require surgery to be alleviated, where excess tissue around the throat will be removed. For obese individuals, loss of weight will go a long way in alleviating sleep apnea and generally breathing. Your best course of action is contacting your doctor if you feel that you might be suffering from sleep apnea, or if you feel that someone who you know is suffering from sleep apnea. Thank you for watching. See you soon, and don't forget to subscribe.